So we'll quickly try to look at another preoperative procedure. That's like one of the things that is very important to do before a an operation is done in a surgery. So one of it is informed consent. So informed consent is just all around the patient. You are trying to tell the patient all about what will happen during the surgery, what will happen after the surgery, and all of that. Do you understand? What the surgery is about. The patient is not an animal, so they deserve to know what will happen to their bodies. Do you understand? And why we are doing it. So it's actually a critical preoperative procedure, and here you are trying to explain everything to the patient and making sure that the patient understands. Okay, so it's both a legal and ethical process. It's something that you need to do it. Okay, and later when issues come up, it can also cover you as a medical professional. All right, because every evidence is there that you actually met with the patient and you spoke with them. Sometimes agreements are even there, you sign. Okay, so it's a process where a healthcare provider communicates with the patient about the planned surgery. Now it empowers the patient to make an educated decision about their care. Sometimes you bring many options and they have to choose. Okay, so key elements of informed consent is you tell them about how the diagnosis will be made and the procedure. You tell them about the risks and the benefits. You tell them about the surgery they're about to do to them. What are the alternatives? You tell them what's the probability of them recovering from their medical condition if they do the surgery to them. Okay, what the surgeons will be doing. Okay, then finally when you are done, they have to voluntarily agree. Okay, you don't have to force them to do anything. Okay, so that's just it. So consent is typically obtained during the preoperative assessment, often 1 to 2 days before surgery. The signed form is included in the patient's medical records. Okay, so that if any issue comes up, they can always go back to the hospital records and always get that, okay, yes, it was explained and so person signed it. Okay, because your patient could switch up if there's a complication after the surgery and so on and so forth.